helping make your life easier. Moms Every Day.
Good afternoon, I'm Katie Wilson with Moms Every Day. Today we are talking about a very serious topic. It can be a very debilitating disease, and that is multiple sclerosis. So today I'm joined by Dr. Paul Ferguson. He's a neurologist at Cabell Huntington Hospital, and he specializes in multiple sclerosis. So for those that don't know much about this disease, why don't you tell us about it?
Sure, absolutely. Multiple sclerosis is a bit more common than most people would think. It affects about 400,000 people in the U.S. and a little over 2 million people in the world. It tends to occur more often in women. It's usually diagnosed between the ages of 20 and 40, but we've seen age extremes all the way down to early childhood through mid-60s.
Okay, so I know that your hospital does provide treatment options, so tell us about those.
We established a multiple sclerosis clinic at Marshall Health in conjunction with Cabell Huntington Hospital in 2013. We started out with a whopping 35 patients.
Wow.
We've grown the clinic to a little over 800 patients now, have a full service of opportunities for our patients to get treatment across really every available option. We do clinical trials. We have a physical therapist that's on staff with us, clinical pharmacist, pharmacy technician, nurse practitioner, nurses, and then of course myself.
Okay.
Big program.
Yes. I know that there's currently no cure for MS. So, you know, how important is treatment and how effective can it be?
So the treatments are really effective, especially the newer generation of treatments. What a lot of folks don't realize is that multiple sclerosis really had no effective treatment until about 20 years ago. Wow. And really since 2011, a new generation of therapies have come out, as well as infusibles through an IV that really keep the disease completely at bay. Most patients do very well, see very little advancement in their disease. The key is diagnosing it early and treating aggressively. Yes.
So, you know, who does this typically affect, and when should they go in to see if they have this?
So oftentimes it affects women more than men. In fact, it occurs at about 3 times the rate in women than men. Usually symptoms start in the 20s, perhaps even a little bit before. Multiple sclerosis presents a couple of common ways. One is with progressive vision loss that usually takes a couple of days, plateaus, and then gradually gets better. It's usually much worse in one eye. Weakness, numbness, tingling, even walking difficulty are all presentations. Individuals that have family members that have multiple sclerosis are at a much elevated risk as well.
Interesting. So for people in this area to have this kind of treatment that has developed over the years into something so big, why is it so important to have treatment, you know, so close to you?
Well, it can be quite inconvenient to drive to places far away that specialize in the treatment of multiple sclerosis.
Right.
It's nice to be able to provide everything that a patient could need right here in their hometown. We also seek to try to keep from inconveniencing folks who do travel a great distance, and in conjunction with the hospital, we're able to do a lot of the things that would typically be done over multiple visits all in one day.
Talk about convenience.
Yeah.
So another thing, with all these patients coming into Cabell to get these treatments, do they ever run into other patients that have MS as well?
Yes, they do, especially in our infusion units where patients are getting treated. There's usually quite a few patients in there with the same condition. They also meet each other in support groups if they live nearby. With the advent of social media support groups as well, some of them connect in that way if they can't get together personally, close together.
And support groups, I mean, with any disease or anything, it's huge, so I can imagine that would be very helpful.
Absolutely.
So it sounds like you guys have so many different treatment options. If someone, you know, knows someone who has MS themselves, where should they go to get more information?
There are a plethora of great resources that are available. You know, honest to goodness, the National MS Society is the best place to seek information about the general management of multiple sclerosis. There are MS certified physicians that and centers of excellence like ours that are listed on there that can connect people to locations that really focus on the treatment of this condition.
Okay, well, Dr. Ferguson, thank you so much.
Absolutely.
Very helpful information, so important. And again, you can watch this segment on WSAZ.com. Have a good day.